The BMA's Medical Ethics Committee is one of the association's most high-profile committees, dealing with many complex issues and ethical dilemmas. The committee's chairman, Dr. Tony Calland, will now talk in detail about what the committee does. Dr. Calland, what kinds of issues does the BMA's Medical Ethics Committee deal with?
Well, in the last year, the Ethics Committee has dealt with such issues as the right to conscientiously object to certain treatments that might be undertaken by practitioners and how practitioners should respond to that. This is also, we have contributed to the General Medical Committee's, the General Medical Council's new guidelines on conscientious objection. We've been major participants in that. We've also looked at matters to do with the Mental Capacity Act. We have looked at withdrawing and withholding treatment in pandemic flu, and we have also made a great step forward by publishing toolkits available to members on confidentiality, on consent, and on the Mental Capacity Act.
What are the most frequent questions doctors contact the Ethics Secretariat about?
I think most of the time members are concerned about issues around confidentiality and how they should handle patient information and the medical records in an increasingly complex world. We really have to deal with requests from all manner of different agencies, be they social care, the police, insurance companies, and doctors are, I think, to be fair, confused from time to time to know how they should let the information be passed on or not, as the case may be. So the rules are important, and the Ethics Committee has some very clear guidance on that issue.
The Medical Ethics Committee always attracts a large field of doctors hoping for election at the ARM. What does being a member of the committee entail?
Well, it doesn't require a detailed knowledge of the law, religion or medical ethics, but it does require that the member will be able to reflect on the arguments that are put to the committee by the lay experts who do have detailed knowledge, and apply those arguments into the clinical context. And this requires obviously experience of working with patients and working as clinicians, but also it requires a knowledge of ethical principles so that the arguments can be examined and reflected upon and then put forward in a fair and meaningful way. Bringing your own prejudices to the committee is generally not helpful.
So you don't have to be an expert in law and ethics to stand for election?
No, you don't. You need to have an interest in good argument, in balancing harms and benefits, and looking at matters from different perspectives, the perspective of the patient, the perspective of the public, the perspective of the profession, and balancing all those so that the committee can come, when possible, to a coherent outcome.
So how important do you think the work of the committee is?
The committee's work is extremely important. It has positions and gives advice and briefs Parliament on a number of complex issues, and recently we've given briefings to parliamentarians on such matters as abortion, on hybrid embryos, and on organ donation, all of which are parts of BMA policy. And have had a significant influence on those debates going on in Parliament. We also give advice to members and how they should respond to media requests for information locally.
So if a doctor wants to get involved with the Ethics Committee, what should they do?
Well, the first thing really you have to do is to get to become a representative of the ARM, the BMA's conference, and the best way to do that is to go along to your BMA division and get the division to promote you as their representative at the conference. Alternatively, one could get elected onto one of the craft committees, GP committee, consultants committee, and then be nominated to go to the annual representative conference, and from there you can submit an application for election onto the committee. All the places that are available are elected via the annual conference route.